Hi, my name is Ann Arneson.
My name is Yvonne Beltran.
I'm Mara Peterson. We are all fourth-year medical students at Loyola Stritch School of Medicine.
Our project is an immersion service experience in the local community to bridge medical students and the homeless population. Some context as to how we got involved in this project. The Ignatian Service Immersion Program at Loyola offers opportunities for medical students to become immersed in a culture different from their own. In the summer of 2018, we saw the opportunity to immerse ourselves with our local community, partnering with Housing Forward and serving at their summer transitional shelter. We were so profoundly impacted by our experience, we wanted to study the impact of such an immersion on students who participated in this new local program after us. The social determinants of health play a large role in the delivery of healthcare and health outcomes. It's important for students to have exposure to and become familiar with the needs of the underserved. Extended immersion experiences differ from traditional didactic education in that they offer opportunities for students to foster genuine relationships with people in different communities, learning from them and leaving a positive impact on those communities. Our project had two aims. We wanted to provide medical students with an opportunity to engage with local community members experiencing homelessness. And second, we wanted to measure the impact of this program on students' perceptions of homelessness and their knowledge of social services.
Our data comes from 4 students who participated in the program in the summer of 2019. These students worked with Housing Forward's Summer Transitional Shelter Program, which differs from their year-round shelter in that it supports a smaller cohort of clients who have a guaranteed bed in the shelter throughout the summer. This allows students to build relationships with the same participants throughout the 12 weeks. Volunteer responsibilities included assisting staff with running the shelter, delivering interactive lessons on various health-related topics, and participating in street outreach. Students were given 2 surveys, pre and post experience, the Attitudes Toward Homelessness Inventory, ATHI, which is a validated survey, and a questionnaire on social services. They also completed a free response reflection after the experience. Scores from the surveys were compared for each individual, both pre and post. We completed an analysis of their ATHI total scores, which is shown here. A higher score indicates a more favorable attitude toward homelessness. The results were mixed on average, but the scores did not show a significant change post-experience. There were changes seen within the different subscores of the ATHI. The affiliation subscore indicates someone's willingness to affiliate with homeless people, which includes their level of agreement to statements such as, "I would feel comfortable eating a meal with a homeless person." All participants showed an increase in their affiliation subscore after the experience. Analysis of 2 other subscores shows that both pre and post experience participants thought that societal causes were a greater contributor to homelessness than personal deficiencies. Results from the social services survey shows there were no significant increases in a participant's knowledge of social services. The post-experience reflections gave some of the greatest insight into the impact of this program. One participant remarked, "Human experience is just that, it needs to be experienced. I don't think you can impart humility or empathy through a lecture."
We drew multiple conclusions after analyzing our data. This experience helps students obtain insight into the various factors of how and why a person experiences homelessness. Our participant survey results showed differences that speak on the difficulty to measure the impact of this experience. We found that qualitative surveys were the best way to gain insight into the impact the students experience. This is best seen in the quotes of the post reflections you can see above. Additionally, each person had a unique experience from who they talked to what activities they took part in. This also contributes to the differences in our results. Insight on a participant's implicit bias was noted highly. As a student said, "I now deeply believe homelessness is not encapsulated in one singular image. This means by which people come into experiencing homelessness also spans such a degree, something I failed to understand before." Going forward, we will compare the 2020 cohort's virtual experience to our current data, build upon a formal curriculum on social services, and assess the program's impact on the community. Additionally, we encourage medical students to develop similar initiatives as well as support other programs within our own institution, such as Loyola Street Medicine Program. Thank you for your time in viewing our poster.